Thanks, Mrs. Stanley Okolo. You lead the West African Health Organization. Thanks to be here with us. To go directly to the first question, what is your impression about this meeting today?
This is, as you know, our first sit-down meeting since the COVID pandemic came to us. And you can see how highly attended it was by ministers. But one of the things that is really very encouraging is the expansion of the SWEDD project from little beginnings when we had only 9 countries. And now at this meeting, you could see not only do we have 4 other countries who are with us, the Congo, the Gambia, Senegal and Togo, but we also have other regional economic communities who are coming. We have been graced, of course, by having our partners all with us together. So this is a very successful meeting today. And of course, as I'm sure your viewers might know, the meeting was preceded by 2 days of technical meetings. And yesterday we had a meeting of the regional economic communities, including Africa Union, being here at this meeting. So that is really very encouraging.
Great. You mentioned the COVID-19. How far it was an obstacle toward the project?
Well, you know that COVID-19 did a few things to us. So number one, there were some downsides. One of the downsides was the fact that we couldn't travel. There were generalized lockdowns. And one of the other downsides regarding this project was not only the fact that we couldn't support the countries in terms of their projects and do supervision missions, but that actually there was an increase in gender violence. There became an increase because during lockdowns when people were, if you like, localized with families and things, we noticed that there was an increase, or there were increases in gender violence, in violence towards women and children, and towards vulnerable people, not to talk about the health issues. So that's one thing it did for us. However, but there is something that is good, which is related to this. One of the lessons from COVID is the power of multi-sectoral collaboration. So with COVID, we brought transport, communication, education, security, health. All of them were focused on tackling COVID. Can you imagine the power of that when we bring it to the issue of SWEDD? Because we then bring gender, education, planning, health, and all focused on improving the women's empowerment. That will be a fantastic.
Talking about women, this is our next question. What is the WHO doing to help SWEDD countries to address women and girls' vulnerability, especially those related to health access?
And you see, we at the moment, as I'm sure you probably know, are coordinating the SWEDD project in phase 2. And with our collaborators, UNFPA, we're also coordinating it in favor. So it's not only the question of our coordination, operational coordination, but it's also the question of our convening power in bringing the governments together up to the highest level. It's the question of advocacy in what we are doing in terms of helping them achieve the objectives of SWEDD, which of course has to do with this improving of vulnerability. But specifically, we have also introduced a Declaration of Rights, and there are about 8 of them, which we are now advocating. It has been adopted by the Assembly of Health Ministers of all 15 ECOWAS countries. They adopted this when we met in November in Abuja. But what we're also doing is to push this, and it includes in terms of how we empower, we put it into laws. We put it into laws in terms of how we empower women to have responsibility for their own health, in terms of how we prevent early marriages, in terms of how we insist on education of the girl child and the boy child, in terms of so many areas, up to 8 of them, that are within some of the laws of the countries, but not in others. So we harmonized them, brought them together, and took it through the Assembly of Health Ministers.
This is a general question. What makes the SWEDD project an exemplary model to replicate?
You know, the beauty of SWEDD is really what I had mentioned before in terms of the way SWEDD works by bringing together the various sectors of government to aim at one thing only, which is the autonomization of women. And that comes from bringing all those things that will support it, whether it is in terms of having commodities available for contraception for those who choose it, or whether it's in terms of insisting on free and compulsory education for the girl child, or whether it's insisting on banning genital mutilation, banning early marriages. That is the beauty of SWEDD. SWEDD does not come to tackle only one thing. SWEDD comes to bring together all those things that will make us meet the strategic objective of improvement in women's empowerment. If we do that, we then are improving the lot of the family. We're improving the earning power of the woman. And you know what? That actually has been shown in scientific studies to improve the economy of the country. That is why it's really an important approach.
The last point, we need your recommendations to the minister taking part to the session of the SWEDD Regional Steering Committee.
I think the one very powerful recommendation, if it is only one, is let us remember what we did in COVID. Let us not lose it. We are stronger when we are all working together, both within the countries and as a regional body. And it is really important that we continue to have that peer support, the countries coming together in terms of promoting and pushing this agenda. But it's also important that we continue to challenge harmful practices within our countries, and not only utilize the laws to make sure that we put them on the law, but also to enforce them. And one of the things that is key, we have learned from some of our advocacy visits, is that that becomes more doable when you utilize the religious leaders, the cultural leaders, and the people, community leaders, because they have to have the ownership of this project.
Thanks very much.